Well, health staff in the Northern Territory have revealed some of the confronting violence and alcohol abuse and sexual abuse that they're dealing with. Some have been assaulted themselves regularly, and the violence is making it impossible for the hospital to recruit people to fill vacant positions. Joining me live is the branch secretary of the Australian Nursing and Midwifery Federation in the Northern Territory, Cath Hatcher, I should say. Cath, thanks so much for your time. What are you seeing? The last couple of months, have they got worse? How long has this been going on?
It's certainly been going on for about 3 years now, and it has certainly escalated over the last few months. With what's been going in the media, some of the nurses and midwives are telling us that, they think that Facebook and the media is overplaying it a little bit, but it's definitely happening. The assaults are happening, and the increased numbers of community people that need to come to the hospital to get arms fixed, lacerations to their heads stitched by going to theatre, etc., is getting worse.
So is the media overplaying it, do you think?
We've been in town here for the last 24 hours. I haven't seen any violence or anything as yet, and touch wood, I hope I don't, but some of the staff are telling us that it's no worse than usual. That's been going on for a couple of years. But certainly over the last couple of months, when they have had a decrease in their elective surgery, but their surgery is still going flat out with emergency type of cases that are coming through emergency department.
Right, so the bulk of the work is still that emergency department, as you say. And we're talking about Alice being a town in itself. I know there's other surrounding areas that you would service as well. It's only around 25,000 people. So if the emergency department is so overrun, I mean, what kind of injuries and how serious are the cases coming in there?
You're talking axe involved, knives involved, etc., that come in from either surrounding communities or from within the Alice Springs township. But that happens all over the territory, unfortunately. Some are describing it as a little bit living in a war zone at times when they're looking after the cases through ED or theatre or on the surgical ward post-operation. The nurses and the midwives are struggling. Their staffing levels are about 30% down capacity. The executive are trying to fulfil those positions with casuals and agencies. But unfortunately, because of perhaps media and what's been going on over the last 3 to 6 months, definitely, but has been going on longer, that nurses and midwives don't want to come to work in Alice Springs because they've heard the violence, they've heard the staffing, ratios to patients are high, which is true. So they're not coming, unfortunately.
Yeah, it's a bit of a double-edged sword. You want everyone to know what's happening in Alice Springs, but when they do know, the people that you need to go there perhaps have a bit of a second look at that. Cath, talk to me about domestic violence and children. What are you seeing as they present in the health system?
It's certainly, I don't know the complete statistics, but it's certainly higher and has always been in the higher levels compared to the rest of the states around Australia, which is very unfortunate. You've got overcrowding in the communities within the Northern Territory, which does not help towards the domestic violence and the sexual abuse of young children, particularly. The overcrowding needs to be managed. There needs to be some more housing built in the communities, but then we've got housing being built and has been built in the communities. And unfortunately, the people in the communities are not looking after or respecting the houses that have been built for them. There taking off the wooden doors to burn on the campfire out the front. They might cook some delicates in the oven that perhaps you shouldn't put a whole kangaroo in the oven, but you are, with tar and all, and then wonder why the oven is not working anymore. They're the sorts of stories that I've heard over the last 20-odd years of living in the Territory. So major number one is to decrease the overcrowding in the houses. Then hopefully this will stop some of the domestic violence, but also the alcohol plays a big important role. We all need to have, reduced buying, which is what the Prime Minister has put in place, although I'm not sure that that's going to work, but the communities need to be all dry.
What would work? What doesn't work in your experience?
I don't think reducing the times of takeaway alcohol are going to curve the problem. I think that's going to increase crime.
Is that, Cath, and I'm sorry to interrupt you there, is that because you're talking about chronic alcoholics? Is that what you see?
Yes, well, a chronic alcoholic, and if they have limited supply to consume per day or none at all, they're going to go through withdrawals, they're going to get angry, they're going to commit more crime, they're going to break into some of the bars, hotels, clubs in town, they're going to take alcohol so they can drink for their own purposes or their family. And I don't think that the reduction of time to take the alcohol takeaway away is going to help.
So have you had to remove hand sanitizer from the hospitals?
Yes, I didn't realise it was that bad in Alice Springs until yesterday when I started to use the hand sanitizer, and they have not to refill any of them within the hospital. All of the nurses and midwives have a small portion on a clip belt on the uniform that they can use themselves. Otherwise, the local people are taking the hand sanitizer, the whole kit, away with them to unfortunately drink it.
Wow.
But that's also for other things.
How frequently was that happening?
I believe on a weekly, if not a daily basis. But also in the shops in the Territory, you can't go and buy deodorant sprays. It's all locked up. You need to go and buy methylated spirits in the locked up cupboards, and also cooking vanilla essence is also in a locked cupboard in the supermarkets that you have to ask to have a bottle from the cupboard.
Well, Cath, you've certainly enlightened us with your experience this morning. We thank you for doing that. And I know you're a busy lady. Thanks for talking to us from your car this morning. I appreciate that.
You're very welcome. Thank you very much.